Now, to help you understand hippie Ronell's is, we're on page 4. Sorry, Dr. Laura's giving me the 4 sign. We're on page 4, which should have been spun at the top. So page 4 is where we're at. And hippie Ronell's is what every clinical test is about. So this is called the hippie Ronell's page. If you don't understand hippie Ronell's, you've been taught it, whether you know the mnemonic or not, is that you do a history first, then you inspect, palpate, percuss, and instrumentate, then range of motion, orthos, neuros, x-rays, labs, and special testing to get the diagnosis and determine the case management of a case. So that's what this kind of takes you through very slowly on the left margin over there. So I just want you to understand how this works. If you are a portal of entry provider, and that means if you're a neurologist, a neurosurgeon, a cardiologist, a chiropractor, it doesn't matter who you are, you have been taught that that is the order of evaluation when a patient first comes into your office. That you do a history and determine what physical exams, what you're going to inspect, palpate, percuss, and instrumentate, because Blue Cross Blue Shield isn't going to pay for you to do everything. Government Medicare isn't going to pay for everything. If they're coming in with a cough, they'll pay for a chest exam. Okay, but they won't pay for, an endocrine exam. So they won't pay for a reproductive exam. So realize then that the history determines what exams or what's going to be IPI'd, inspected, palpated, percussed, and instrumentated. Now, if you find out that it's probably a musculoskeletal problem, then you're probably going to do a pretty extensive Roan exam, which is range of motion, ortho, and neuro, which is usually what we do an awful lot of. So you have 6 range of motion, ortho, neuro, state right cases, or 14 or 12 stations denoted to just seeing if you can do range of motion, ortho, neuro, and interpret the information properly. Then finally, X-ray lab and special testing is where we confirm things. So that's why I make the funnel narrower, because when it gets down here, there are a lot of wrong things to do and only a few right things to do to confirm, or the right labs to do. So we get a little fussy about those, and that's why sometimes X-ray feels harder, because you have to pick the right diagnostic imaging tools and those kinds of things. And then finally what you have is the diagnosis, and then you determine the case management. Now the case management usually kind of gets divided first and foremost into 3 basic areas. Is it yours? Are you the primary care person for this case? Or do you need to co-manage it with somebody? Or does it need an immediate referral to an ER or immediate acute care? So case management then determines whether or not it's a chiropractic case. And then from there, if you say, yes, it's a chiropractic case, I'm either going to be, it's all mine, or I'm going to co-manage it, then you would say, yep, now I do my leg checks, my specific x-rays, my challenges to the body, whatever it is that you're going to do, nutrition-wise, test them, then it's your case. But hippie Ronell's is not a chiropractic exam. It is a portal of entry exam for every physician in the United States of America to be proficient. So that's why we want to make sure you're proficient enough that when a patient comes in, can you make the right decisions, and do you have an understanding about how to cooperate with the medical community. So a lot of times you have to know, will they cut it out? Will they bone pack it? Will they give it antibiotics? Or are they worried about infection? What kind of things are they concerned with for the risk of the patient, and what are some of the basic procedures that they do? So you have to have a little better understanding for some of you of what the medical community is going to do than you've been paying attention to in school. So we're going to kind of brush that off and clean that up too. So this is just an overview of why this is a clinical test and why it's so very important. Now, a very special tool given to you on clinical day is that at the back of a little notebook that is for the candidate, at the very back of that, when you flip it over, has 2 blank pages that are perforated. Don't tear them out. Just keep them right in the book, because the book will act kind of like your clipboard. But those 2 blank pages are worth their weight in gold, okay, or platinum, or whatever you think is special. But because if you use a half a sheet for a case history, then that means that your 3 case histories can be a half a sheet each for collecting the data as you talk to the patient, so that when you're out in the hall processing before you enter your post-encounter probe, you can be thinking about it. Okay, and then use maybe about a quarter of a sheet for your physical exam, and maybe a quarter of a sheet for your setups, usually enough for most of us. But your orthoneuros can be a third of a sheet. And if you'll notice then, we've used 2 sheets very wisely to collect data while we're encountering the patient. Now, as we do, the different things in this book, the exercises and stuff, I will come back to this page and show you a sample of how to do an orthoneuro page and show you a sample of how to do a case history half page. But I wanted you to know these pages are here. They're right in the front of the book. All your organizational stuff is right here in the front of the book about what the test includes, about the flow of the test 1 through 25, and about your extra sheets so that you're reminded right in the beginning, and we will come back and reference these quite frequently.